guys, it's Con from Exo Medical Spa, and today we're going to be discussing a little bit about fillers. So we'll talk about what they are, what they do, a couple different variations of what type of fillers there are out there. So let's just talk about fillers in a general sense. What does it do and how do we use it? So fillers, you can just think of it as the actual definition for what it is. We're taking a product and we're filling a void, or we're filling a volume loss. So as we age, a couple things happen. We lose bone, we lose fat, and we lose collagen. Let's just talk about our face. So when we start losing those items, those are areas where we have volume. So if you've lost it over time, then you want to replace that volume. If you're younger and you want to enhance volume, then that's when you can use the product to enhance a feature. So let's just take an example as lips, and we'll cut away and I'll show you a couple areas that I do fillers and how we replace volume into enhance or just replace something we've lost over time. But for the lips, right, let's just say we want to enhance it. Then how do we fill that void? So we can use filler, such as an HA filler or a hyaluronic acid filler, to produce volume into that area. As we age, if we lose fat, if we lose collagen, or we lose structure in that area, then how do we replace that? One of the analogies I like to use is if we think of our lips as a balloon. When we're young, that balloon is nice and full and volumized, right? But when we age, when we lose volume, that balloon begins to shrivel. And if you've ever seen a balloon that loses volume, what happens is it crinkles, it creases, it just doesn't look right, and it has a whole bunch of lines in it. So we can use filler to blow that balloon back up to its original size to get you back to where you were. If you want to go past that, then you can add more volume, more air, more structure into that balloon and get it past that part of where you originally were. So that's a little bit about filler. So all we're doing is replacing volume. Now people ask me, Con, I do not want the duck lips, or I don't want to look fake, I don't want to look plastic. So fillers can only accomplish what you want it to accomplish. A filler, a syringe, a product only has so much volume in it. So we can go progressively and keep adding volume until you get to your happy place. So you come back every couple weeks, every couple months, and we can keep adding volume to either one, enhance an area you want to enhance, or two, replace the volume you've lost. Each syringe comes with, on average, about 1 milliliter of volume, right? So 1 milliliter is probably, if I emptied it out, it'd probably fill a fingernail, a pinky fingernail. So that's how much volume is in one syringe. The syringe itself looks very, very big, but the volume within that syringe is very, very minimal. So you can think, if you've lost so much volume over time and to the point where you're like, hey, I just don't look like who I am. I feel very, very tired. I wish my lips used to be what they were. I wish my cheeks were what they were. If you got to the point where you notice that, that's quite a bit of volume. And as we said, it's bone. You've lost bone in that area. You've lost fat in that area. And collagen is what keeps our skin tight, and you've lost collagen in that area. So for me to try to get you back to where you were, or if there's a fear of looking artificial, it's very, very hard to do that in one sitting. It's really over multiple sittings and multiple years that people start getting that overdone look. If that's what you're going for, fantastic. But if you're going for the natural look, that's awesome as well. And at my practice, and really for myself, I'm more of a progressive provider where a little bit at a time, and if you've ever come see me before, I use that term very often. Go home, learn your face, come back, we can always add more. It's always easier to add than to try to take away. So let's cut away. We'll talk about some areas that I do fillers, and then we'll come back and we'll talk about each individual product. So in this video, you'll notice that I'm using the pillar technique or the tenting technique. There's really no right or wrong technique in regards to lip filling. Everyone has their own different style, but for this patient, this is the technique I used. And we're using Juvederm Ultra Plus for her specifically, and you'll notice she's very, very comfortable. We have a couple different ways to numb. Of course, she was her first time, so we use topical numbing to make her as comfortable as possible. And then also within the product itself, there's lidocaine. So the more I inject, the more numb she'll get as well. So you'll notice I'm going very slowly, very gently. Once again, it was her first time, so we wanted to make her as comfortable as possible. So after we finished lips, we realized we did have a little bit of product left, so she wanted to focus on her nasolabials as well. We did tell her that you may not get full correction of the nasal label, which she was perfectly fine with, but she was content with her lips, so we put the rest of the product somewhere else for her. In regards to any fillers, there you will have a period of 1 to 2 weeks where there is a little bit of swelling. The lidocaine will make you swell a little bit too. So whatever end treatment that you see currently at the moment isn't necessarily going to be indicative of the end result. So hyaluronic acid, using the right product for the right area, knowing which family you use, and knowing what kind of product within that family you use. They're all important criteria in regards to filler. So hopefully that gives you a little bit of a better understanding of what fillers do, and hopefully calms down that stigma of having that overdone look. So hyaluronic acid family, fillers to replace a volume loss or to enhance volume. Many different ways you can do it. But come on in, schedule a free consultation, and then we'll take a look at what your goals are, really develop that care plan for you, and then we can go from there, okay? So if you like this video, give it a thumbs up, and if you like this channel, definitely subscribe. We're gonna promote a lot more content and really just educational items, so you can always have a place where you can go back and recall and continue to educate yourself. Talk to you later, bye.